We basically deal with any of the internal medical issues that a patient may have that are non-surgical in nature. Immune-mediated diseases are probably our most common pathology that we treat. Diagnostic options available to us continue to evolve dramatically. We rely heavily on imaging. Radiography, CT are a big part of what we do. Ultrasound is probably even a larger part of what we use imaging-wise. It's a wonderful, readily available, non-invasive, very informative diagnostic tool that we use. And then of course, kind of a battery of lab work tests that help us establish a diagnosis and support, appropriate treatment implementation and response.
We try to utilize all of the specialized tools that we have available, all of which are essentially at the level of what we would find at a human hospital. We have great endoscopy equipment, new radiology equipment. So we recently got a C-arm, which I think will help us in regards to diagnosing diseases that have a more dynamic nature, so things like tracheal collapse, diagnosing swallowing problems. Increasingly, as more people get training in those techniques and with those new pieces of technology, I think that what that means is that we can offer animals treatments for diseases that never used to have any sort of treatment or option.
I think communication and client involvement is a very important part of internal medicine, perhaps more so even than the other specialties, and that probably is what I spend the majority of my time doing, is trying to ensure that I have a full understanding of why the patient is coming to see me, what the medical history and what the concerns are. That's very important for me to establish firsthand. That's always sort of a history and a dialogue I want to have firsthand with the client. And then of course, kind of the continued communication of what the results are of the diagnostics that we perform, what the recommendations are going to be treatment or management wise. And then of course, finding out how that patient is responding and progressing after the initial consultation.